I'm looking at her chest. So she would have a sports bra on or something like that I could see the chest. I'm looking at, making sure that the AP is smaller than the transverse. She doesn't have any deformities of the chest. She's got a nice straight back. Her effort of breathing, she's not using any accessory muscles, okay? She's not using her belly. She's not using her intercostals. She's not using the sternocleidomastoid or the trap to breathe. So she has, I don't know what her respirations are, but it's probably 12. So inspection-wise, she looks really good. And I always look at things like fingers, coloration. I don't see any cyanosis, and the hands look fine. So the next thing you're going to do is palpation. So I want you to do at least 2 areas. And I've got the history beforehand, so I know there's no pain. But if I had pain, I would really localize in that area, see if I could find out what's going on. So I've done her 2 spots, right, and her lateral. So now I wanted to do her thoracic expansion. I kind of demonstrated before, but stand up so we can see this. So I want you to take a big deep breath in and out for me. Sorry. All right, so she's got good thoracic expansion. It's equal bilateral. Okay, have a seat back here. Okay, now what I want you to do is I'm going to have you say 99 in just a minute here. Okay, say 99.
99.
Again?
99.
Huh? Yep.
99.
Yep.
99.
Okay. Again.
99.
Great. So it's equal bilaterally. I don't feel anything, I hardly feel it at all when she has a shirt on, so it's a little bit difficult. But there's no significant vibration. Okay, so I've done all the palpation. Now I'm going to do percussion. Okay, so we'll go to the next one so you guys can watch. So, then usually what I do is below. It's really hard to do because I don't have my come here. Enough that you guys can hear it. And then make sure when you're on the lateral, you want to be, when you're doing this, you're in between the ribs. You're not on the rib, right? Because that'd be dull. So you want to make sure you're in between the ribs. And I always stand on the right side of a patient unless I can't get to the left. I mean, I'll walk around if I can't get there, but I always stand on the right side of a patient. Okay? So auscultation. Most of my patients aren't undressed. Okay? So the best way to do it. Now, what I want you to do is take a big deep breath in, but open your mouth when you do it. And out. Again, in and out. And I would go up underneath her shirt, but I don't want you to feel uncomfortable, so. Again. So you see how I'm doing it. In the back, I just go up underneath the shirt on the back. Again. Good.
You know, out of shape.
Do what?
I'm out of shape. I know I have old people, it's hard.
See why you started the bases?
Yeah.
Again. And then again. And you can see that I'm putting pressure on with my stethoscope, right? So I'm putting pretty good pressure on there, getting a good seal. When I'm by the bra of a person, I go underneath the bra. I didn't on the sides because I just didn't do it, but that's, I always do that, okay? So bronchophony, okay?
$99. $99.
Okay, and then do that same thing, all those areas. I want you to whisper 1, 2, 3. Okay. So that's whisper, pectoriloquy, and then egophony. So I want you to say E for me.
E. E.
A little longer for me.
Oh.
E. Okay.
E.
There you go. That's it. That's the chest exam.
Do you just press it again? Will it save it?
Not too difficult.
Oh my